Day to our listeners on Guam and in the CNMI. It's now time for Total Health right here on Joy FM Radio, where your questions get answered by health professionals. If you have any health-related questions, we would love to hear from you. Call your questions and comments in at 472-1111 or text or WhatsApp 686-9999. If you're in the CNMI, please call 323-1113. Welcome everybody to Total Health.
Hi, and welcome to Total Health. My name is Rose Trina, and I'm here in the studio today with Dr. Jonathon Thorpe, internal medicine and lifestyle medicine specialist, and Katy Yamamuro, doctor of physical therapy. And our topic for today's show is exercise and dementia.
Thank you, Rose, and Katy. Welcome to Total Health. I'm so glad to be able to be here today with you and be able to talk with you about two important topics, physical activity and dementia. Unfortunately, a disease that affects literally millions here in our country, and one that is unfortunately increasing in prevalence every day, every year that passes. And so it's one of vital importance for our community. So welcome. Glad that you're here.
Thank you. Glad to be here.
Now, you're a physical therapist and I know a full-time mom, and very active, engaged in the community in many different projects. I don't think I can name the long list that you're engaged with, but you, as a physical therapist, tell me, what do you enjoy doing most with as a PT, as a physical therapist?
Wow. Well, there's so many things that I enjoy about physical therapy. It would be hard to just name them all, but I really enjoy working with neurological diagnoses, seeing patients that have had issues with some aspect of their neurological system.
So maybe like a stroke in the past or something.
Right, yeah.
Yeah, wonderful. And, unfortunately, so many people with strokes develop what we call vascular dementia, where they've had a diminished blood flow to part of their brain and diminished memory because of the lack of blood flow there. So dementia is a very broad category, and physical activity is a very broad category. I mean, everything from weightlifting to stretching and aerobic. And so we're going to take some time to kind of define these different terms and better understand how they affect our short and long-term health. I just finished my first triathlon on Sunday. I was thrilled. I was a little sad because there was jellyfish in the water, so they had to do a modified triathlon. So it's a triathlon, but it was actually more like what we call a do-a-thon, where it was just running and biking, but we did a run, bike, run. And so instead of a swim, we had to run, and then the bike and the run afterwards. And it was incredibly fun. I was a little bit sore and tired, actually more tired than sore, which to me indicates I was stretching reasonably well beforehand and afterwards, because I was surprised. I thought I was not going to be able to move. But being able to come out of that feeling pretty good was really rewarding.
Excellent.
And I just a few minutes ago saw a patient in clinic who through physical activity essentially has reversed his diabetes. I mean,
Wonderful.
Went from a hemoglobin A1C, so that's a marker that we use for average sugar, of over 14. So the computer said greater than sign 14. So it might have been 15, might have been 16. I don't know.
Wow.
It means practically that his sugar was probably in the 400 range most of the time.
Wow.
Normal sugar should be no higher than about 110, 120 for a pre-diabetic, and less than 100 for normal. And he was, that 4 or 5 times that. And you know what? Guess what his A1C reversed to just by physical activity?
What?
7.1.
Wow.
I mean, no medicine can do that. I mean, he was on medicine beforehand, he was on medicine afterwards, but the difference from that over 14 to 7 was purely from physical activity. So I just cannot believe the effect it is. So let's dive into this important topic of dementia and physical activity. Let's maybe first of all define dementia. Would that be helpful?
That would, yes.
Do you want to take a stab at that, or would you like me to?
Well, since my area of expertise is more on the physical side of things, I'd be happy for you to define.
Sure. So dementia means practically in layman's term memory loss, but specifically an impairment to function. So if you don't have an impairment, then it's not necessarily dementia. But when you can't get through your routine activities on a daily basis, then it's labeled as dementia. There's many different types of dementia. There's things like frontal temporal dementia, there's Parkinson's dementia, Alzheimer's dementia, vascular dementia. And I think for our viewers, it's less important for us to look through each specific subtype. But I'm going to talk about specifically Alzheimer's because that's the one that's most common, unfortunately, in our country, and that leads to incredible impairment and a burden of disease for so many individuals and family members, caregivers, etc. So let me ask you this question. Does physical activity make a difference when we consider the onset of dementia, when we consider treatment of dementia, when we consider even reversal of early dementia? Am I asking the right questions?
I know
here,
it
Katy?
it seems a big stretch to say that something could actually reverse dementia, but actually you're right. Physical activity can play a huge part in preventing and treating and even reversing.
Now, I think it's important to define reversing because there is a kind of a point of no return.
Right.
So it's kind of that early dementia, what we call mild cognitive impairment, and then that goes into kind of the earliest or mild forms of dementia.
Right.
Is that kind of where the physical activity makes the biggest difference?
Right, it is. And that's why it's important to catch it early on. Catching the dementia.
Okay.
At first we might not notice, the person certainly doesn't notice that much. They may notice they're getting a little forgetful, but it usually gets to the point where they don't realize it themselves. They think everybody else is confused. But if you're concerned about a loved one, the earliest they can be diagnosed or identified as having dementia, the better the treatment outcomes.
Or even mild cognitive impairment.
Right, even a mild cognitive impairment. So obviously prevention is always better than treatment. So we want to prevent it as much as possible, and we'll talk about ways of doing that, of course. But even for people that have the mild cognitive decline, and there's actually research that shows UCLA, the University of California at Los Angeles, has actually done quite a bit of research on dementia, and about they've kind of identified a 5 to 10 year window from the first onset of symptoms, so including that mild cognitive decline. If it can be identified and get some intense lifestyle therapy treatment, then it is possible to reverse.
And I think that's key when you say lifestyle therapy. And we're not only talking about exercise.
Right.
We're talking about diet also,
Right.
water, avoidance of stimulants, caffeine, sugar, specifically sugar.
There's so many different
Alzheimer's,
things.
there's some that are in the medical literature, they're calling it type 3 diabetes. It's like kind of the manifestation of diabetes in the brain in a sense. And so it absolutely does have a sugar intake and regulation in the body absolutely does have an impact on the mild cognitive impairment onset and the progression to dementia.
Right.
Yeah. So you're saying within that kind of that 5 to 10 windows year period is the kind of the sweet spot to intervene.
Right.
Yeah. So as a physical therapist, what are some of the signs you've noticed for patients who kind of have that mild cognitive impairment, and how would we alert our viewers to maybe prompt them to seek medical care, to ask their health providers, do I have dementia?
Right. And, there's usually a lot of screening for those who have, regular healthcare checkups. There's usually screening that's done for, like, say, people 65 and older. I don't know, maybe even younger than that. I'm not sure. You're more on that side than I am. But so to get screened would be the first place to start if you're, concerned about a loved one at all. And because, it's not just, like you said, it's not just being a little forgetful. But sometimes that just being a little forgetful can be leading that direction. So it never hurts to go ahead and start some lifestyle changes, even if you notice a decline in your memory. So, yeah. Okay.
Yeah, great. So I think the first key point for our listeners is to say, if I am myself or if a family member is struggling with forgetfulness, and it's progressing, if they're having difficulty completing the tasks they normally would have done in the past, like balancing their checkbook or remembering when and how to pay for bills, misplacing things consistently. I'm not talking about the occasional time you misplace your keys. I do that all the time.
Oh yeah, we all
I don't
do.
have dementia, thank goodness. But I mean, it's those things where it's a recurring pattern, recurring theme, and to seek medical care. And there are some standardized tests that we use to screen. And if the screening is positive, the screening is it's a simple 3-question test. It's very easy to complete.
Right.
And then if that turns positive, then we do a more extensive set of questions, and then we go through and look for reversible causes of dementia, from infectious, metabolic causes like your thyroid levels being off, liver problems, hormonal problems, heavy metals, nutrition deficiencies. So there's a handful of tests that we order as essentially basic screening tests to treat reversible causes, and then to tailor treatment around that. But I'm just so glad that you're giving hope to our viewers that there are ways to prevent, treat, and reverse. We have about a minute or so before going to break. When we come back, we're going to talk about more specific actionable things. But I'm curious, do you have a patient story maybe that you could quickly share of success you've had of anyone? I know I might be putting you on the spot here, so if you don't, then no problem. Just curious.
Well, I've seen definite improvements. It's not like people are usually referred to physical therapy for dementia. That's usually not the sole reason. So usually I'm treating something else, and dementia is just kind of a comorbidity.
Right.
But I've seen personally with friends and family members, I've actually seen improvements with the mild cognitive decline and implementing lifestyle changes and an improvement in that.
That's awesome. That's awesome.
Yes.
So you've had some firsthand experience of improvements with that. That's really exciting. Well, we're going to take a break here for just a couple of minutes. When we come back, I'm hoping that we can kind of get into some very specifics about what type of exercise, how frequent, and I'm also hoping that we'll have some viewers call in, or some listeners call in today to ask some questions for us. We'll be back in just a moment here for Total Health Radio.
If love is a color, God never settled on one. He did say his love was for everyone. No exclusions, no exceptions. And he doesn't give anyone his permission to exclude people from his love. The choice is theirs to be rescued, but no one has been left out of his rescue plan. Jesus did not come to be the rescuer of some, and breaking his rules will not stop him from loving people. Walk with him, talk with him, tell others about him. Love people without exclusions. Joy FM, family-friendly radio.
My ceiling fan chain is hanging up there. I pull high, medium, low, and I need some air. How I wish I had a chain out the side of my head. I'd pull it once for high so I could get out of bed. When the day's underway, I'd select medium, an even speed that combats the frantic and tedium. And when it's time to rest, I'd pull it to low, and then go to bed and nod off real slow. But as it is, my life is always in fast. I wish I had that chain to make my motor last.
What's your day like today? Wish it could shift out of high speed for a little bit? Well, here at Joy FM, we're the kind of station that doesn't yank your chain. We're here to provide a positive place that's not hectic and not dull, because the music and message we provide are the medium that helps keep your motor running smooth. Thanks for letting us provide some fresh air in your life.
Joy FM, family-friendly radio, joyfmradio.net.
You're tuned in to Total Health on Joy FM. Please get your health-related questions ready and call them in at 472-1111 in Guam, or text or WhatsApp us at 686-9999. If you're in the CNMI, please call 323-1113. Total Health will be right back after this short break. Si Joe Moasi, and thanks for listening to Total Health on Joy FM. We want to hear from you. Call in with your health-related questions at 472-1111 in Guam, or in the CNMI. The number to call is 323-1113. Text or WhatsApp us at 686-9999. And now, back to the show.
And welcome back to Total Health. It's so good to be here with Dr. Katy Yamamoto. Sorry, I just completely slaughtered your name there. I sincerely apologize. I'm Dr. Jonathon Thorpe, an internal medicine, lifestyle medicine physician here at the Guam Seventh-day Adventist Clinic. Katy, we're talking about dementia and the impact that physical activity has on it. So we're going to get to some specifics of type, frequency, etc. But I want to talk about more mechanism for just a minute. So help us to understand when we engage in physical activity, regardless of what type it is, what is the effect on our brain?
All right. Well, I'm so glad you asked. The complete physiology of how exercise helps dementia isn't fully understood, just like most physiology. There's so much we don't yet understand. But the things we do know are that exercise will actually strengthen brain tissue. It makes it more resistant to aging, more resilient. And some of the ways that it does that, number one, it helps prevent some of the other risk factors for dementia, and like obesity, diabetes, heart disease, all of these things are risk factors by themselves for dementia.
Right.
So exercise, of course, we know helps prevent those things or helps treat those things. So
and reverse them.
Yeah, and reverse. So just by exercising for those alone, it helps prevent dementia as well.
Right.
So that's one aspect.
So in other words, the first thing is that exercise helps reverse and treat risk factors for dementia.
Right.
So one of the types of dementia is vascular dementia,
Right.
which is related to the buildup of cholesterol and calcium in the wall of the blood vessel, resulting in limited blood flow. We know that exercise helps reverse atherosclerosis of the heart, of the legs, and the brain too. So that's kind of what I hear you saying is the first component or aspect of the impact of exercise on our brain. Okay.
Right.
Help us understand the
So
next.
that's one component. Our brain needs healthy blood vessels, just like the rest of our body, but the brain probably most importantly because it needs all that nutrient and stuff that the blood brings, and it also needs to have the toxins removed. So increasing circulation is another aspect. Obviously, exercise increases circulation all through the body, but the brain is included. So that brings more oxygen, more nutrients to the brain tissue. It perfuses it more, so it's more spread out. It's more accessible to all areas of the brain. And then it also removes the toxins. As we know, a lot of dementias are related to the buildup of toxins. So we want to get those things removed. So increasing the circulation is the second mechanism.
And that's a really good point you bring up because there's something called glymphatics. I just discovered this term. It's a relatively newer discovery of how our brain clears these toxins. And we've probably know the term lymphatics. So lymphatics are how a lot of our fluid is moved in our body outside of our blood vessels. Well, the lymphatic system is in the brain, and interestingly, it specifically is at its highest amount of function when you are sleeping. And so you tend to sleep better when you've exercised, depending on the time of exercise. I mean, if you exercise late in the evening, like I did last night because I didn't have time in the morning, but I didn't want to miss the exercise session. I still slept good, but you tend to sleep better when you exercise earlier in the day.
Right.
But the quality of sleep impacts the depth and quality of your the quality of your exercise impacts the quality of your sleep, which allows for the clearing of the toxins from our brain, just like good blood flow does also. Okay, so let's go into the next point.
So then also exercise helps to actually prevent, or it actually helps preserve brain cells, and it can actually also help stimulate the growth of new brain cells. Back, I don't know if you remember, but I remember when scientists told us that, you could not grow your brain cells. What you were born with was what you had, and if they were destroyed, then tough, you're stuck.
Tough luck.
Yeah, but they've actually learned better, and they've learned that you can actually stimulate the growth of new brain cells, and exercise is one of the mechanisms that can produce that.
Awesome.
So by producing new brain cells to potentially replace maybe some ones that we've damaged, that of course is always a good thing.
That's awesome. Very cool. So exercise prevents other diseases that contribute to dementia.
Mm-hmm.
Exercise helps improve blood flow to the brain,
Right.
and exercise directly impacts the growth or regeneration of brain cells.
Right.
That's
Right.
neat. Okay. Any other mechanisms?
Those are the main ones.
Those are the main ones.
Yeah.
Okay, good to know. Okay, so let's start getting a little bit more granular, actionable for our listeners here today. So when you define, how do you define physical activity? I think that's an important term to define.
Yeah, that is true. Physical activity, when we talk about exercise, there are three main categories. There's aerobic exercise, which is what people usually envision, like running. You know,
Right.
They picture somebody jogging down the street
Right.
with headset on. And then there's the anaerobic exercise, which is weightlifting. That's the muscle
Strength.
building, strength
Okay.
training. Then there's flexibility, stretching.
Right.
So those are the three main categories. Now, when we talk about exercise as it relates to dementia, preventing, treating, usually most of the research is done on aerobic. So
Okay.
that's the type that gets
like
your
the
blood
running.
flowing, right?
Uh-huh.
Like the running. And so it's not that we don't need all aspects, but aerobic is what has been shown to have the biggest benefit.
Okay. So in other words, we probably need to do a little bit of everything.
Yes.
And a physiotherapist is sitting looking at me like, absolutely.
Absolutely. Because preventing dementia is not the only aspect of life.
Right.
There's so many other things that the
Right.
weight training and the stretching do for our bodies
Well,
to help
case
us.
in point, osteoporosis, which is another common ailment many older patients, primarily females, deal with, is directly treated and reversed by weight-bearing exercises. So
Right.
if you're only doing your aerobic exercise, you're missing out on the value of, putting those bones under stress
Right.
and strain with some weights to help allowing them to get stronger. Because if you don't use it, you
lose
it.
it.
So that
Yes.
goes for muscle and also goes for bone strength too.
Right.
Just to summarize again, we've got three big categories of exercise, and that's the aerobic exercise, the anaerobic or weightlifting type or resistance type exercise, and then the third is the flexibility, stretching type exercises.
Right.
So is there a difference between the term physical activity and exercise?
Not really.
Okay. Yeah, practically speaking, there isn't.
Practically speaking.
Yeah, from my understanding, physical activity is regular, it's
Mhm.
planned, and it's intentional.
Right.
And so that's kind of where I kind of distinguish it in my brain. Like we're going to be physically active on a regular basis. It's going to be intentional. It's going to be planned for it. Not to say that you can't get it kind of accidentally throughout the day,
Oh,
but
right, yeah.
but the best is to have it on that regular, planned, intentionally.
Right.
Yeah. Okay. So when we think of those three different categories, maybe do you want to start with aerobic exercise first?
Yes, that would be great.
So what are the types of aerobic exercises that are beneficial for patients either at risk or with dementia to help treat and hopefully reverse it?
So what you want to do whenever you're trying to figure out, like if you're not already on an exercise program and you're trying to figure out where to start, aerobic exercise is what gets your heart rate up and keeps it up. You want to get your heart rate elevated, and you want to sustain that for a certain period of time. Periods of time can vary, and we can talk more about what specific research has shown too. But essentially, you want it to be sustained for a good enough time to make a difference.
Okay.
So, getting your heart rate to the right level is important. That depends on multiple factors, but your age, your regular heart rate, that sort of thing.
Right. So looking at like your resting heart rate, your maximum heart rate, and that we can get really into the technical details, but we don't want to be lost in the forest
Right.
here. So let's keep a big picture. And so, I think one question you kind of alluded to here a minute ago is if you haven't been exercising and you're going to start. So there are tools such as the Physical Activity Readiness Questionnaire, PARQ, that can be used. So if you are not exercising at all and you have other risk factors like heart disease or you've had a stroke in the past or you have liver disease, kidney disease, etc., you need to be speaking with your health professional to really gauge, am I safe to undergo and start an intentional physical activity program?
Right. Mm-hmm.
So let's put that aside and start with those assuming that they have been physically active. How much aerobic exercise should an individual be aiming for when we come to this topic of dementia and mild cognitive impairment?
All right. Well, my typical recommendation for anyone for aerobic exercise can be done 7 days a week.
Mm-hmm.
You hear a lot about 3 to 5 times a week, and that's fine. But if you set your goal as 3 times a week, it's going to be easy to miss that.
Right.
If you only work it into your schedule 3 days a week, and something happens on one of those days, then, well, you've already lost 1/3 of your exercise.
That's what happened to me last night. I had to go do it at 10 o'clock at night, so I didn't lose it.
Right. So that happens. But if you set your goal for 7 days a week and something happens on one day, well, then you've still exercised for 6 days. So I like to say, set your goal high, because if you set it low, you're not going to get any higher. Whatever you set your goal at, you're not going to get any better than that usually. Mm-hmm. Most of us aren't that way. A lot of the research that's been done, however, has shown that just 4 days a week, for 30 to 60 minutes, depending on the study, one study was 30 minutes, another study was 45 to 60 minutes, could actually reduce the severity of like mild cognitive decline. It would actually reverse.
Okay. So it's about 120 minutes of planned physical activity from what I'm hearing.
Right.
30
4 days
minutes,
a week.
40.
Yeah, at least 30 minutes. So yeah.
So
Yeah,
and
at minimum.
that aligns with the national guidelines for exercise and physical activity, which is 150 minutes of moderate intensity or 75 minutes of high intensity physical activity for most adults. And so we want to be aiming towards that 150 mark.
Right, yeah.
And so the 4 days, 30 minutes, barely there. 5 days, 30 minutes, right on the point.
Right.
Yeah. This has been an exciting conversation. We're so glad that you're joining us here today on Total Health. We're going to be back in just a couple minutes to continue the conversation.
When everything's quiet, what do you hear? Do you hear doubt, fear, frustration, sadness? The circumstances and emotions of life can weigh heavy, but we're here to help fill the emptiness with encouragement. Here to fill your day, your thoughts, your heart with positive, uplifting words and calming sounds. All we ask is, if we've helped you through a tough time, why not pay it forward and consider financially supporting this station so others can benefit from it as well. Joy FM, family-friendly radio. The homeowner paid people to keep his house in shape. He was leaving on a trip and didn't know how long he'd be gone. The staff kept the kitchen clean, the gardens in shape, and the dust away for a week, 2, a month, maybe more. We're just not sure. At some point, they must have thought there was no real point in making sure the homeowner's property was taken care of. After all, he wasn't there. There was a lot of disappointment when the homeowner returned to find the employees demanding their wages after refusing to follow instructions. This Jesus story may sound familiar. Sometimes Jesus told similar stories to make a point. He's given you a purpose. He's given you work to do. He said he'd be back. Maybe you think it's been long enough. Maybe you're just tired of trying. Maybe you'd rather be forgiven than faithful. But Jesus said he was coming back, and he wants to greet faithful followers. Joy FM. You've not been perfect, and you wanted to be. You've not always been honest, and you thought you would. You've not always followed, and God gave you directions. Now, reject discouragement. God forgives. He can refresh your feet and point them in His direction. He can exchange good intentions with great instructions. His love has no ending, and His forgiveness is a prayer away. Don't stay where you've been. Take new steps in your great adventure with God. Joy FM, family-friendly radio.
Welcome back. You're listening to Total Health on Joy FM. Call in with your health-related questions to 472-1111 in Guam. If you live in the CNMI, we want to hear from you too. Call 323-1113. or text or WhatsApp us at 686-9999. And now, here's more Total Health.
Welcome back to Total Health. This is Dr. Jonathon Thorpe with internal medicine and lifestyle medicine physician at the Guam 7 Adventist Clinic, and I'm here today with Katy Yamamuro. Sorry, Katy. I'm determined to say your name correctly. A physical therapist, and we're talking about the importance of physical activity in preventing, treating, and reversing mild cognitive impairment and dementia or memory loss. So we've talked a little bit about various aspects of what dementia is. We've talked about what physical activity is. We've talked about types of exercise. We were just starting to talk about aerobic exercise. So we were talking about the number of minutes. It was important for us to aim for, aiming for that 150 minutes of physical activity on a weekly basis.
Right.
So when I think of exercise, I think of three things. I think about type, amount, and frequency. So walk us through, give us a prescription very specifically. So what type of, how much, how intense, and then also how do we work on progression of that exercise?
All right. So if you've never been on an exercise program before, aside from if you have serious, comorbidities, if you need to talk to your doctor, please do before you start. But if not, if it's just a matter of getting going, I usually recommend to start with walking.
Okay.
Because it's free.
Yes.
It's not complicated. Most of us can do it from wherever we live, or maybe you might have a short drive to a nearby park. You just need a good pair of comfortable, supportive shoes, pretty much. And, of course, nice weather helps, but it's not necessary.
In fact, I like walking and exercising in the rain because it keeps you cool here in Guam.
Keeps you cool, yes. Might as well. And there's always going to be some rain here in Guam. There's rain almost every day. So don't let that hold you back. But it is possible, even though exercise outside is ideal, because you also get the sunshine, you get the fresh air, multiple reasons why exercising outside is best. If for some reason a person can't get outside for some reason, that doesn't mean they can't exercise. You can do something as simple as marching in place in your house or jogging in place. It may not be quite as exciting, but hey, you can do it while you're doing other things. I don't usually encourage watching TV. I don't think it's good for our brain. But if someone does watch TV, why not march in place while you're doing it? Actually, new research from the University of Boston, I believe, showed that the more sedentary a person's lifestyle, the more there were thinning of the brain regions that are critical to memory formation, and the more poor a person's activity level in their 40s, so in their age 40s, the more likely their brain volume was to be lower by the time they reach 60.
Wow. So over the course of 20 years, the decisions and choices you make in your 40s will have an adverse effect on the size of your brain by the age you're 60.
Right.
And if we were to extrapolate that out, by the age you're 70, to my age you're 80, that's going to be continued decline in the brain volume. Incredible. So really, it's just, again, highlights the importance of making healthy decisions today to prevent and treat and reverse chronic disease today and in the future.
Right. Yeah. If a person listening is in their 20s or 30s and they think, oh, I don't need to worry about dementia, that's not going to be for a long time. Well, yeah, you do, because like you just said, the decisions we make today affect us for years to come. Right. So, yeah.
No, that's phenomenal information. So you're saying that walking is a good first exercise?
Yes. Now, it doesn't have to be walking. If a person enjoys jogging or swimming or bicycling, all of those are wonderful aerobic activities.
So I think the one word you just said there, enjoying, is really key. Physical activity is fun, and it's intended to be fun.
Right.
So finding someone to do it with, a buddy, a partner, will actually help you be more successful at it, keep you accountable, and will also bring pleasure or joy because you're talking and communicating, doing it and stuff. One of the ways we get quality time as a family is exercise.
Excellent.
So heading off and getting the kids out running and biking and stuff is really key. I know we've gone with your family walking and biking on Saturday afternoons. It brings a joy to be able to talk and exercise at the same time.
Yeah, it's wonderful.
So finding ways to make it pleasurable is key.
Because if you don't enjoy what you're doing, you're very very unlikely to maintain that program.
Right.
So you want to find something that you enjoy, find something that can fit into your schedule. Now, you may need to modify your schedule. This is, you want to think about it as a prescription.
Mm-hmm.
You've got to find a way to fit it into your schedule.
Right.
So modify your schedule in whatever way you need to, but do work it in somewhere.
And that's a really good point. It's something that we call habit stacking. So habit stacking is where you have one habit that leads to the next habit that leads to the next habit that leads to the next habit. So, for example, I make a conscious decision the night before that I'm going to lay out my exercise clothes and I'm going to put it in the hallway at the top of the stairs. So when I get out of bed, I have no choice but to look at those clothes. And I have to consciously say, no, I'm not going to exercise versus, hey, it's there. It's one less barrier for me to start my exercise routine in the morning.
Right.
And so building a sequence around what you're doing and modifying your schedule accordingly. I know I've talked with many patients and how do we incorporate physical activity in our day? And for many, it's like, well, either to or from work during the commute and stopping at a place where you enjoy or it's safe to exercise and then to go for a walk for 15 to 20 minutes.
Right.
So you get off work, you've had a busy day. No better time than to stop, exercise, and then continue on for your routine in the evening.
And it's wonderful for so many things. Stress management, especially if you've had a stressful day at work. It's a wonderful way to just kind of
blow
release. Just release all those negative emotions and just clear your mind, be able to think better. And by the time you get home to your family, you'll feel so much better.
Absolutely.
And you'll probably be more fun to be around too.
Absolutely. So we've talked about different types of aerobic exercise, the walking, the swimming, exercise bike, stationary or bicycling.
Either one.
So these kind of low intensity sports. How does a person know if they're exercising hard enough with these low intensity sports?
That's a good question. You can do all kinds of things to figure out your heart rate. Like we kind of alluded to earlier, there's a lot of ways that we can find the target heart rate. And
in other words,
really
we can make it something complex that's simple.
We can make it very complicated, but we don't have to.
Good.
An easy way, just for the average ones of us, is you should still be able to talk while you're exercising. You should be able to hold a conversation with the person next to you, if you've got a buddy that you're going with. However, if you can sing, then you're not exercising hard enough.
Okay.
You shouldn't have that much energy and lung capacity. So you want to be able to be, you should notice an increase in your breathing. You should be breathing a little bit faster, but you shouldn't be gasping for air.
I think that's so important. And that's where, like, even if you're someone who has many chronic illnesses, let's say you have lung disease and heart disease, you can still exercise. And if you're exercising at an intensity where you can carry on a conversation with someone, you're in that moderate range of physical activity, moderate intensity. So if I was to say mild, moderate, strenuous, how would I use that sing talk to distinguish between mild and strenuous?
So if you're not able to talk, to hold on the conversation, then it's too strenuous.
Okay. Yeah, for most people.
Right, for most people.
Yeah.
Now that's going to be a different level for people too. People that are more physically fit are going to be able to do more and still hold a conversation.
And that's a really good point, that as you get stronger, you can do more, whereas maybe a month ago, 2 months ago, you couldn't even do that much. And I know that from personal experience because I'm in the midst of a training routine right now. And last night I did a sequence, like I said to myself, I could never have done that, 2 months ago. And I was out of breath. But I could never even attempted it 2 months ago. So as you get stronger, you're able to adapt and be able to now carry on that conversation where before you couldn't even barely breathe, get a couple words out.
Right.
So strenuous activity would be classified as I can't barely talk even one or two words.
Right.
Definitely can't sing. Moderate intensity would be I can talk comfortably in a conversation, but I can't sing. And then mild
low
would be
intensity. You can sing to yourself while you do it.
Okay, so it makes it really practical for our listeners. So we want to be aiming for a moderate intensity activity. So being able to carry on a conversation but not sing for about 30 minutes, ideally.
Yeah. Ideally, the longer, the better. Typically, 60 minutes is the goal. If you have to break that up during the day, it's acceptable, but try to make it at least 20 minutes at a time.
Right.
So So if you can only do 30 minutes, maybe to start with, then do that for a week, maybe even 2 weeks, but then increase.
Right.
So never allow yourself to get into a comfortable zone where, this is pretty easy.
Right.
If you're at that point where you feel like, I can do this just fine now, then you need to advance yourself a little bit.
Right.
So try going a little bit farther, try going a little bit faster. Right. One of those two, you can modify yourself and increase, give yourself a little bit more of a challenge.
Right. So you want to maintain kind of that, just a little breathlessness, being able to talk but not sing, and you'll find that you're going to have to work harder and harder as you exercise more and more. Because I have
that's a good thing.
It is a good thing, and that's what we want. That's what we're really looking for that. So, and that's kind of that progression piece. When we look at an exercise prescription, where we want to look to what type, how much, how frequent, but then also the progression. So every 3 days or every 5 days to increase by 1 minute of physical activity, or by aiming to do the same distance or duration in a shorter period of time, so that you're more intense with it.
Right. Yeah.
Okay. So those are kind of really the keys with aerobic exercise.
Right.
Okay. So when we in a few minutes we're going to talk more about anaerobic, or the weightlifting and the flexibility training, because those are equally important for it. Just thinking about the weekend here, I ran this triathlon for the first time. It was a triathlon sprint, so it's nothing major, but my goal is by the age 40, I'm going to be running a full marathon. That's my goal. By age 50, it's an Ironman triathlon. So whether or not that happens, be careful. I've just announced it on radio here, so now I'm going to have many people holding me accountable. But, a few months ago, I really wasn't able to do some of these activities, but through an intentional training program and working at it regularly, 3 to 4 times per week for me, based on my schedule, for that 30 minutes a day, has really brought me some incredible milestones.
Excellent.
And I think of one patient in particular who could barely breathe about a year ago when I met this person. I think I've shared this story on the radio before. He gave me permission to talk about him. But how, this was someone with chronic lung disease, chronic heart disease, and was basically sitting in his chair, couldn't move. And we started a simple exercise routine, walking in place, holding onto the back of his chair, on the back of his sofa, while he had his oxygen tube connected to help him breathe. And I'll tell you in a minute how much he progressed in just a period of a few weeks.
All right.
We're here on Total Health Radio. We're so glad that you're joining us here on Joy FM. We'll be back in just a minute.
Everyone's journey takes them down a different path. Some paths are smooth, some can be a little rocky, and some are downright treacherous. Wherever your journey takes you, we'll be there to encourage you with every step, to help you navigate the obstacles, to make sure you don't walk alone. Along the way, we would just ask for your financial support, because the best journey is when you walk together. Joy FM, family-friendly radio.
Do you ever wonder what it would be like to travel through time? You could go back, change a few things, maybe that mullet hairstyle or that whole scruffy-faced Miami Vice stage. Or you could fast forward to the future to see if you still have hair, or more important, today and forever.
Joy FM, family-friendly radio. JoyFMradio.net.
And we're back with more Total Health. Give us a call with your medical questions. Number to call in Guam is 472-1111. If you're in the CNMI, the number to call is 323-1113. Or you can text or WhatsApp us at 686-9999. Now back to the program.
Welcome back to Total Health. We're talking today about the importance of physical activity in preventing and treating mild cognitive impairment and dementia, memory loss in common terms. And we've talked here together about the importance of aerobic physical activity, meaning aerobic being things that get your heart rate up and that get you breathing a little bit harder. Examples would include walking, jogging, running, swimming, biking, stationary biking, rowing. I mean, the list of activities are long and extensive. Katy, we're talking, we're going to just start talking about what caregivers can do. And before we get to that, I've got to give the answer to what I was talking about a minute ago with my patient. So this patient went from not moving to holding onto the back of the sofa while using his oxygen to walking 1,200 feet within a period
Wow.
of a few weeks, came in, I mean, numbers were through the roof improved.
Wow.
I mean, just all the anthropometric measurements, meaning weight, blood pressure, etc., the A1C, the sugar control, by walking. And then the other part of this was that he had incorporated beans into his diet. And so the fiber really was very helpful for him. So yeah, he was someone who was super, super sick and couldn't barely move. And yet we got him walking without stopping to 1,200 feet.
Wow.
And I mean, that
Wonderful.
was like a marathon to him. But it truly was transformative for his health and how well he felt. So coming to our caregivers, because we have so many people that are caring for those with dementia.
Right.
Give us some tips for them.
Well, when you're dealing with someone with dementia, no one method is always going to work. But if you are a caregiver for someone with dementia, my biggest recommendation is to somehow get them active. It can mean many different things. You could try just saying, "Hey, come on, let's go for a walk." That may work, and they may be all for that. Hopefully they would be. But if not, you don't necessarily have to say you need to exercise. Typically, if you pinpoint somebody with dementia on something like that, they're going to balk.
Okay.
But if you suggest something that they can do with you, it's going to go over a whole lot better. Like, hey, let's go out and check out the tree down the street. Remember, it
Right.
looked like it was getting ready to have some mangoes ripe on it. Let's go look at it. Something where it sounds like something fun. Some activity, and they're going to be a whole lot more likely to do that. So some way to get them up, get them moving. The longer they spend sitting in a chair, the worse their symptoms are going to progress.
Right.
So we want to do everything we can to keep them from sitting, to get them active.
Right.
And, the caregivers know their people usually pretty well.
Right,
So,
exactly. And it's interesting that you make that point about sitting, because so many of our patients have arthritis. We just had a question come in. What kind of exercise is good for arthritis? And arthritis and dementia are very commonly seen together in the same
right.
individuals. So what's the answer for that?
Well, not knowing exactly where the arthritis is located.
Let's assume knee, because knee arthritis or hip
lot of
arthritis is
times.
very, very common.
Walking is one of the best things you can do for arthritis.
Why is that, Katy?
Because of the circulation.
Okay.
And usually, walking on it may flare up the pain a little bit at first. And so a lot of times that discourages people. Oh, I can't walk. It hurts too bad. So they sit. And that just makes it worse.
Right.
So do what you can do. Start off with just walking a short distance, and then try to progress that every day. Try to go just a few more steps.
And so when you say a short distance, let's be very specific for someone who does have knee arthritis and just cannot move. How far do you say that the first few days to be walking?
Well, depending on the person, maybe it might be a stretch just to walk across the living room.
Okay.
If that's a challenge, then make that your goal.
Okay.
Once you reach that point, then progress from there.
So it might be across
outside.
the living room and then down the hallway, and then across the living room, down the hallway and out the doorstep.
Right.
And then across the parking lot, and then across to this other side of the street. I mean, just
Right.
progressively going on. And would you limit it by pain?
If you're having sharp pain,
Uh-huh.
then you can decrease.
Okay. But ache in the joint is okay?
Right. Try if you've got sharp pain, then try lessening the intensity first before you stop altogether.
Okay. So back off on how long you're
Right.
walking or how fast you're
or how
walking.
fast, right.
Yeah. Okay.
So the sharp pain we want to avoid. If it's some achiness, that's not quite as bad. It hurts, of course. Any kind of pain hurts, but what you want to do is just try to keep challenging yourself.
Right.
Don't let that pain hold you back, because the more the pain holds you back, the worse your pain is going to get.
Right, and that's the key. You got to kind of grunt through it. Got to push through it.
Right.
So let's take a few minutes and talk about strength training and balance training, because those are equally important parts of physical activity.
Right.
Which one do you want to go for first?
All right, let's do strength training.
Okay.
That's a lot of fun, and a lot of times, especially coming from a woman's point of view, a lot of times we think that strength training is something for men. Because we don't want to get big and bulky, But strength training is just as important for women as it is for men. So if you're a woman, you have just as big of a responsibility to pick up something to challenge your muscles. Doing some strength training at home could be something simple like doing push-ups. If you can't get down on the floor, you could do wall push-ups. Doing squats is a good way to build up the muscles in your legs and lower back.
And you can hold on to something while you do those squats too. Yeah.
Yeah,
you don't even need to go down.
balance.
Like we say, a true squat is till you're basically sitting without a chair underneath you, where it's at 90 degrees between your leg and your thigh. But you could go to halfway down and then back up, halfway down, back
totally.
up.
And you can do it against the wall. Actually, research has shown very good EMG studies on doing squats against the wall.
Okay. So it activates the similar muscles when we look at it technically with that EMG study as you would if you go all the way down without the wall behind you.
Yeah.
That's really good to know. Because sometimes I feel like I need the wall to help me.
Yeah, right. It does. It keeps you from falling over too. So that's an added bonus. But so you can do a lot of things. You can get an empty milk carton or milk jug, I should say, and fill it with water, maybe just halfway, according to what your tolerance is, and use that for lifting weights with your arm, and that way you can regulate the amount of water in it, so how heavy it is. But
I really like that's very practical and very inexpensive to do. So a water bottle, a milk jug, and start off maybe a quarter full, half full, 3/4 full, and even 1 or 2 reps, and then slowly up to 5 reps. And then we talk about reps, which is continuous, and then sets, which is a break between the repetitions.
Right.
So you might do 3 repetitions and then wait, and then do another 3, wait, and then the next day it might be 4, 4, and 4, and 5, 5, and 5. The key is that you want to do more than what you're doing right now.
Right, exactly. Something challenge your muscles. You want to find something that challenges yourself, and if you're a little bit sore the next day, like a little bit, that's a good thing. You want to be a little bit sore the next day. You should still be able to move, though. You shouldn't be like completely out sore.
Right.
So if you're like incredibly sore the next day so you can't move, then that was a little too intense.
Okay. No, good, really good at tips. Let's talk about flexing and flexibility. So briefly, what's your tips on that?
All right. Stretching is a great way to prevent problems with our joints. So you want to implement stretching after you've warmed up your muscles if you're doing intense stretching. So after you do your aerobic exercise is a good time to do stretching. So stretching your arm muscles, stretching your leg muscles. Whatever muscles you have used for exercise, you want to stretch those.
Okay.
So
awesome. That's good to know. So we got to work on the stretching is really to prevent injuries going forward. The strengthening is to help maintain muscle bulk and muscle volume, and the aerobic really helps work our lungs and our heart.
Right.
And all of those, particularly the aerobic, from what the research shows, particularly helps reverse the mild cognitive impairment, early dementia, and treat dementia at any stage.
Correct.
Yeah, right. This has just been so exciting for us to talk through and to think about. I have a question about the. I don't know where I was going with that. So let's talk about signs and symptoms to watch out for when you should stop exercising. What is the kind of like, hey, I've got a stop sign here I need to be watching for? What would you say?
Well, there's a few different things. If you're short of breath, like not just breathing heavy, but if you're short of breath, like gasping for air, then you need to stop.
Okay.
At least slow up, see if that improves, and then if not, just stop altogether. Because that means your lungs aren't getting the oxygen, your brain isn't getting the oxygen it needs. So that's usually someone who already has an issue with something. If you're having intense pain, pretty much anywhere in the body that is caused by the exercise, then you want to stop because there's a reason for that pain. If you start feeling your heart doing weird things, like palpitations, or if you notice that your heart rate, if you're monitoring your heart rate somehow and it's like really high, again, that's kind of a vague thing because everybody's different. But then yeah, you need to. And
I would add to that is chest pain itself. So if you're having chest pain with shortness of breath,
that's true. Yes.
You need to seek medical care immediately. either calling 911 or going to emergency room if you're having that.
Right.
As we close, I think about a text that I love in the writings of Paul, 2 Timothy 4, verses 7 to 8. I have fought the good fight. I have finished the race. I have kept the faith. Now there is a store for me, the crown of righteousness, which the Lord, the righteous, the judge, will award to me on that day. And not only for me, but also to all who have fought long for his appearing. Exercise is likened to the marathon runners of Greece. And so I encourage every listener to exercise and to continue pushing forward as we do in our faith also.
This has been Total Health Live. Thank you, Dr. Thorpe, and thank you, Katy, for coming in today. To our listeners, if you would like to join us again next week, we have Total Health Live every Wednesday from 5 to 6 p.m. We'll see you again next week.
Be sure to check with your doctors before making any sudden life changes discussed today. Total Health is brought to you in partnership with Guam Seventh-day Adventist Clinic, where health is their mission. We look forward to seeing you next Wednesday. Thank you and Sijuas Maasi for listening to Total Health right here on Joy FM.